The warning from the CDC, the coronavirus is spreading so quickly around the globe, it may only be a matter of time before it begins rolling across the U.S. with the potential to become a pandemic.
The education team at Mass Pioneer was pushed into action very early in the COVID-19 crisis when several of our residents were ill and placed in quarantine at various different intervals. This allowed us to think critically about the steps that we needed to take to protect our trainees and maintain our workforce. And as a result, we were among the first programs in the country to really make dramatic changes in our training program with many different contingency plans.
The fellows really stepped up to the front lines of Mass Pioneer during COVID-19 with unparalleled grace. Patient and trainee care and safety was their number one priority, and without them, we really would not have had the seamless functioning and success that we have had during this time. Their strength really is a tribute to the types of physicians and leaders that we hope to graduate from Mass Pioneer.
When the coronavirus pandemic started, we began working 1 week on, 1 week off. During the weeks on, sometimes it was busy, sometimes the emergency room or consults would be slower. The patients were very grateful that we were there to see their eye problems, and that was very rewarding.
The pandemic has changed my training in that less is being done in person with patient care. I'm also, though, learning how to conduct telehealth, which is going to be really important moving forward.
The biggest opportunity I think that came from all of this, and the biggest change in the residency, is that we now understand the power of going virtual. We've had the opportunity to completely uproot the educational system.
During the pandemic, there are obviously fewer cases, so the focus has shifted more towards training through wet labs, as well as building a knowledge base with online lectures and Zoom lectures.
There have been a lot of innovations to address the coronavirus pandemic. Telehealth has definitely become a lot more prominent and will probably stick around for the better. We've also become a lot more thoughtful about what patients really need to be seen and what visits are necessary, which I think is beneficial.
What I've missed the most during the pandemic is seeing patients for regular follow-ups and being able to discuss cases with my peers and advisors in person.
I think you remember this as a time where everyone in the healthcare field came together and put their best foot forward to help each other out and help our patients.
I don't know of another residency program across the country that would have been able to do what we did together and prepare residents despite an international pandemic in all things clinical, surgical, and otherwise.
I really appreciate all the hard work and how much everyone has stepped up during these unusual times. It's particularly a tough time to be training and coming to work and putting you and your families at risk during this pandemic. I've really been impressed with how hard all the fellows have worked, and I've never heard a single complaint throughout all this time. So we really look forward to watching you grow and being part of our great alumni in the years to come. Thank you again for all your hard work.
These are very difficult times, but the opportunity for innovation in education is very exciting.